Hello everyone, this is the first lecture on hysteroscopy. I am Dr. Jyoti Yadav, your coordinator for this course, and I'll be taking you through this journey on hysteroscopy with me in future lectures. So, the first lecture is on understanding hysteroscopy, how to define hysteroscopy, evaluation, purpose, what are the indications, what are the contraindications, what all types of hysteroscopy we know, what are their advantages and what are their limits. When we talk about hysteroscopy, the first thing which comes in mind, how do we define hysteroscopy? So hysteroscope is an endoluminal endoscope that can be used as an aid to visualize your uterine cavity or to direct the performance of variety of intrauterine procedures. It's a procedure in which cervical canal and uterine cavity is visualized through a scope which is known as hysteroscope. An important minimally invasive surgery hysteroscopy is. Now, as every skill evolves with time, hysteroscopy also have evolved through the years, and at present what we are dealing is the latest equipments in hysteroscopy, the latest techniques on which we are using hysteroscopy for all the surgical procedures in gynecology. Moving ahead on hysteroscopic procedures, the history, as we have already taught, as we have already seen, the setups which were in the earlier history they were like gravity fed irrigation, two fluid containers used to provide continuous flow into the uterine cavity. This was the ancient system which was being used, and with over the time the basic endoscopes were invented, which is a simple tube like a structure which was being used. And with these developing years, we have developed the hysteroscopic instruments over the time, and now today we are dealing with the latest equipments which we have for all the procedures which can be done with the help of the hysteroscope. There were like uterine distension media which were being used over the time in the past, which were like fluid and which were used to expand the uterine cavity for a better visibility. Fluid collections, they were used fluid which were collected in bucket below the patient level, and they were being used. There were like different advantages and disadvantages. The disadvantage was the poor visibility if bleeding occurs. It may wet the surgeon's cloth. So these were the few disadvantages which were in the past. And with these advantages and with the latest equipments, we are now at present dealing with one of the best instruments where the disadvantages are overcome, overruled, and the better instruments have come in the market now, which we are using these days for doing the operative hysteroscopy and different surgeries with the help of the hysteroscope. In 19th century, if I talk, this is little bit on the history part of the hysteroscope. First attempt was being used, and these images, they depict early attempts at direct visualization of the uterine cavity as it is being shown in the picture, which you can see here. How the cavity was visualized with the eye here and the scope which is placed inside. And the procedure involved using a basic endoscope for inspection and diagnosis. And Hiscon was one of the media which was being used, and which is a high molecular weight. With the advent of like further advancements, the scope and the instruments were like better day by day, and there were like in 20th century the fiber optics revolutionized the hysteroscopy in the mid 20th century. So it was developed, the flexible hysteroscope was being made. There was a rapid evolution in hysteroscopy which was followed with the advancement in optics, instrumentation, and the techniques which were being on to the further advancements in the hysteroscopy. The late 20th and early 21st century, there was wide acceptance in the gynecological practice, and the advancements driving adoption methods. There were like video imaging which was being used. There were like operative techniques which are used in hysteroscopy. The innovation enhancing safety procedures were also developed, and there were like disposable instruments which are being used in hysteroscopy, and they can be discarded after one use of in the surgery. So better sterilization, better safety to the patient, and advancements. And expanded therapeutic scope, if I talk about, there were like different therapeutic approaches which were being used either as endometrial ablations, myomectomy, and other operative surgical skills which are used with the help of the hysteroscopes. Now, moving on to the purpose of hysteroscopy in gynecology, if I say, the vital in gynecology, or why hysteroscopy is being used, is the first and the foremost thing is to diagnose and treat the intrauterine issues. To look into the endocervix, the uterine cavity, the endometrial lining, the status of the endometrium, the condition of the endometrium, the tubal osteas which are there are to be seen with the help of the hysteroscope. To locate any kind of submucous myoma which is present there, Hysteroscope gives us an advantage of direct visualization of any pathology like polyp, fibroid, or adhesions in the cavity. It helps to locate and remove the lost IUCD, endometrial polyp, and to locate the endometrial even cancers. Now, precise interventions, it reduces the invasive surgeries, promotes faster recovery, to diagnose the septums in the uterine cavity, and to locate the synecdoche. So this is the broad spectrum uses of hysteroscopy these days, and for all these purposes, hysteroscopy has come as a rescue in gynecology, and it has very much advancement, and it's a very simple skill which is being practiced in hysteroscopy. So if I talk about a hysteroscope, what are the key components? So it's a hysteroscope is a narrow tube-like structure with a camera and a light source. The visualization system is images sent to the monitor, and we see on the screen all the images. Second thing which is important and comes while doing hysteroscopy is the distension media. So uterus is expanded with a liquid. The low molecular weight fluids or the high molecular weight fluid can be used as a distension media, which can be taught later. And the gaseous distension media are also there, but they are very rarely used, or these days the obsolete. And the most common distension media which are used are the liquid based distension media. Real-time assessment, as it gives you a clear diagnostic viewing approach, and under direct visualization, we can diagnose n number of conditions in the uterine cavity, and the diagnosis is definitive one. Tissue manipulation, if I talk about the enhanced procedural control with the help of the hysteroscope, and it can be further manipulated. So what are the list of components of a hysteroscope? The eyepiece, the barrel, the objective lens. This is the hysteroscope comprises of these major three parts. As you can see here in the picture, this is the inner sheath, can be used for any of the instrument. Here I have shown a grasper which has entered. There is an inflow tubing, there is an outflow tubing, there is an operating point, the light source. These are the major parts. Now this is the visualization system which you can see on the screen, which comprises again of a camera, light source, and the monitor. Monitor is used where the pictures are being reflected, and your hand-eye coordination. You can see the pictures on the screen and do the surgical interventions or whatever you want to see that is being displayed on the screen. The distension media for hysteroscopy, it can be sterile liquid such as saline, which is very well available in all the operation theaters and easily accessible to everyone. It is like cheaper fluid which can be used for hysteroscopy. The gaseous media, if I talk about, can be carbon dioxide. The uterine wall muscles, as I say, needs a minimum pressure of 40 mm mercury to distend the cavity. Carbon dioxide is ideal for office hysteroscopies. It allows the evaluation of the endocervical canal via insufflators. The disadvantage of using carbon dioxide is it causes gas embolism, which is ineffective removal of blood and debris while there is a gaseous distension. High viscosity fluid like dextran, which is Hiscon, can be used. Low viscosity fluid and electrolyte, if I say the normal saline, as I already told, is the most easily available fluid which is being used as a distension media. Ringer lactate, they are, again can be used as both are the low cost model of distension media which are readily available. But the problem with this is it can obscure the vision and cause pulmonary and cerebral edema in few of the patients. Moving on to what are the indications. The first thing comes indication. The very second time the thought is what are the contraindications. So I'll be talking about few of the indication where hysteroscopy is being used and where we can think of hysteroscopy for particular patient, and I'll be talking about the contraindications. If I say indication for diagnostic hysteroscopy, what comes in our mind? The clinical condition of the patient is to be assessed, and then the hysteroscopy can be thought in mind as a rescue procedure, as an investigation, or as a therapeutic procedures. So if I say the abnormal uterine bleeding, may it be menorrhagia, may it be metrorrhagia, may it be postmenopausal bleeding, identifying the causes like polyp, fibroids, or hyperplasia of the endometrium, which can cause bleeding in such a way that it is known as either menorrhagia or metrorrhagia. Now, second indication as a diagnostic hysteroscopy is infertility workup. In cases of infertile couple, there are many causes which are not even being identified on simple ultrasound. So hysteroscopy comes as a modality where we can identify polyps, we can identify adhesions, uterine septa, or fibroids which can lead to infertility. And once they get treated or they get operated by hysteroscopy, patient conceives very well after the treatment. And there can be better chances even in ART or even without ART. Indication for hysteroscopy where we can think is repeated miscarriage patient. So it is basically used to evaluate the uterine cavity for abnormalities like septum, adhesions, polyps, which are linked to pregnancy loss. Uterine anomalies evaluation can be done on hysteroscopy. Even the treatment can be done on hysteroscopy. All the congenital anomalies may be septate, bicornuate, didelphys, impacting infertility or the fertility of the patient and can even lead to pregnancy losses. Endometrial pathologies is, if I talk on, it is being used to diagnose the endometrial conditions like hyperplasia, polyps, cancers, and it enables the biopsies for confirmation. We can even take biopsy with the help of the hysteroscope. So hysteroscope has come up as a modality even for diagnosis. We have discussed the indication on hysteroscopy. The second thing which comes in mind are what are the contraindication of hysteroscopy. So if I say the contraindication for diagnostic hysteroscopy, the first thing which comes in my mind is pregnancy. So hysteroscopy is usually avoided, especially in the first trimester, because there are higher chances of miscarriage or there are chances that the fetus get hampered. Exceptions for specific cases like recurrent miscarriages or uterine anomalies, where it can be still thought of. If the patient is having an active kind of an infection or PID, so the hysteroscopy is being avoided. First, the infection is being treated, and then we can plan or pose the patient for hysteroscopy in the second sitting. When we talk about infection or PID, there is another type of infection which is acute cervicitis. If it is present, there is an inflammation or infection of the cervix. It might increase the chances of complication. Hysteroscopy should be waited until it is being resolved. We have to treat cervicitis first and then we can plan hysteroscopy. Then if there are chances of uterine perforation, conditions like retroverted uterus, acutely retroverted uterus, when we introduce the instrument, there might be chance that it might cause a uterine perforation. If there are extensive adhesions, which might raise the chances of even perforation, possibly it contraindicates the diagnostic hysteroscopy in this case. If the patient has, or we say, uncooperative cervix, there the cervix is highly stenotic, the cervix is closed, the os is tightly closed, and it might hinder the hysteroscope to go in, then we have to think of either enlarging the cervical os by dilatation or by putting up the drugs like mesoprost, where the cervix is being dilated before we plan for hysteroscopy. So there has to be a chance of acute cervicitis or stenotic cervix, which might hinder for hysteroscopy. So, the various indications for operative hysteroscopy, it can be used to remove the cervical polyps where the condition is known as polypectomy. It can be used to remove the myomas, which is known as myomectomy. Only the submucous myomas, which are causing heavy bleeding or infertility or miscarriages, the indication comes for myomectomy. Adhesiolysis, even to treat the uterine adhesions from surgery, infection, or trauma, there might be adhesions which can be broken down. Adhesiolysis can be performed with the help of hysteroscope. From surgery, infection, or trauma, there might be adhesions which can be broken down. Adhesiolysis can be performed with the help of hysteroscope. Now, if there is a septa correction, we say septoplasty surgery can be attempted even with the help of hysteroscope, and it aids in fertility and pregnancy outcomes. We can even try endometrial ablations where it reduces the menstrual bleeding for women with abnormal uterine bleeding. So, ablation can be tried in those patients, and even for taking up the biopsies or sampling of the tissue, the target tissue is the suspicious target tissue is being taken up with the help of the hysteroscope, and various endometrial conditions are being diagnosed. Disorders, if a patient has a bleeding disorder there or anticoagulants she is on, then better to consult a hematologist before planning for hysteroscopy. If patient has any kind of unstable condition, may it be heart, any kind of comorbidity, uncontrolled hypertension, respiratory issue, it might pose a risk in hysteroscopy. The patient has to be evaluated properly for the anesthetic backup as well as for the surgical point of view. If there is a difficult cervix, as I've already discussed, it might be stenotic. There is we are not able to access the os. It might complicate hysteroscopy. Before doing hysteroscopy, we need to dilate the os. We need to put it the indications and contraindication for diagnostic as well as operative hysteroscopy. Moving on to the type of hysteroscopy, we say diagnostic versus operative. There might be some advantages and limitation of the hysteroscopy in both the conditions on both the types. We will be discussing those. Types of hysteroscopy may be diagnostic or operative. So when we compare diagnostic versus operative, hysteroscopy has served both diagnostic and therapeutic purposes. When used for weaving only, it is termed as diagnostic. When we do it for some kind of a treatment, it is known as operative or therapeutic hysteroscopy. When we say diagnostic hysteroscopy, then identify the causes. It pinpoints the reason for abnormal uterine bleeding, dysmenorrhea, may it be fibroid, may it be polyp, may it be adhesion. You are directly visualizing the endometrial cavity for its pathological appearance. It might be a complementary test which is used for diagnosis, may it be a hysterosalpingogram, sonogram, or endometrial biopsy, which are being taken as a comprehensive evaluation of many conditions. Surgical corrections, operative hysteroscopies utilizing the specialized instrument facilitates the surgical corrections of many abnormalities. When I say operative hysteroscopy, so it is a minimally invasive procedure which are being used with the help of hysteroscope. The surgeries are minimally invasive surgery with a very less downtime for the recovery, and patient has a wonderful stay at the hospital. So the diagnostic and the treatment part might include the removal of the growth or the scar tissue and the correction of abnormalities. Office-based procedures can even be performed, and it can be done in the office settings or the OPD settings, we say. The smaller procedures can even be attempted in the OPD. There is a rapid resumption of the activities. Patients undergoing hysteroscopy in operative hysteroscopy specifically might be discharged in daycare or a day after. So advantages of doing a hysteroscopy in your OPD chambers. So number one thing is it's a diagnostic precision. You are directly visualizing the cavity. So you surpass the ultrasound need. The ultrasound might miss some conditions which on hysteroscopy by directly visualizing we can detect it very well. So the precise identification of the causes like fibroids, adhesions, polyps, septum can be very well identified. So it gives you enhanced accuracy by directly inspecting and make a particular definitive diagnosis. And the targeted areas can be visualized for any kind of gynecological condition and even for taking the biopsies or the tissue for histopathological examination. About treatment. So as we have already discussed, it's a minimal invasive treatment which is done with the help of the hysteroscope. The targeted treatments enables biopsy, polypectomy, myomectomy, or adhesiolysis. Chances of open surgery decreases the discomfort of the patient, improves the recovery, less hospital stay, less cost burden to the patient, less hospital investment for a particular surgery. Moving ahead in infertility, the role of hysteroscopy. So it plays an important, crucial role even in evaluation and management of certain conditions which leads to infertility. It identifies and treats the uterine abnormalities like, as I said, septa, polyp, fibroid adhesions, which are the causes of infertility, and if corrected, patient has a wonderful result. It improves the successful chances of pregnancy, conception, and taking the pregnancy till 9 months and delivering normally. Now, the role in assisted reproductive techniques, as we say ART, the pre-ART hysteroscopy, it optimizes the uterus for embryo implantation. It corrects the abnormalities and so reduces the chances of implantation failure, miscarriages, and it boosts the ART results. Now, the safety and the efficacy, if I talk about, it is very well safe. It is well tolerated by the patients. The patients are being handled in an experienced practitioners, have a wonderful results, minimal risk of complication with a high success rate in the diagnosis as well as the treatment part, and it is often performed on outpatient basis, offering convenience and the shorter recovery, and the downtime is less. Less post-operative pain, shorter recovery than traditional surgeries. Patient has a wonderful stay in the hospital, costing less to the patient, costing less investment for the doctors, higher satisfaction rate as it is minimally invasive with very well improved outcomes and minimal discomfort. Time there are advancement and innovations in this technique. So with the advancements, there is enhanced visualization and precision in the diagnosis and treatment. Ongoing research aims for further improvement in patient care through hysteroscopic techniques. We'll be having more modifications on the instrument, more indications and contraindications, which will be coming up with time with all the innovations in the research which is going on in hysteroscopy, and we will be upgrading our knowledge as the advancement advances. With these advantages, there are few of the disadvantages which I should not miss discussing while doing a hysteroscopy. So risk of complications, there is a potential risk for uterine perforation, bleeding, infection, or injury to the surrounding structures. Anesthesia risk, not to be forgotten. There are procedures which might lead to complications because of the general anesthesia which is being used, and that has to be properly dealt with. Limited access, if I say, it is not suitable for all patients, particularly those who are with specific comorbid conditions. If we say about the cost, procedures might be little costly as compared to the open surgery in the hospital settings, and it has to be properly conveyed to the patient. With the advancement of the procedures we are doing on the patient, the overall cost, overall recovery time might be less. Thank you so much for your patient hearing. This was all about the general basic introduction on hysteroscopy. We will be covering hysteroscopy in detail one by one in further lectures. So stay tuned, stay connected with